Hey everybody, happy Friday. So today I'm going to talk to you all about the Denneroll, which is something that we sell here at the office. I had posted on Instagram that I was going to talk about it yesterday, but we had some technical difficulties with our internet all day. So apologies to anybody who tried calling the office and really struggled. But anyways, the Denneroll. So what is it? We have one in each room. This is what it looks like. So the Denneroll is something that was created by a chiropractic technique called chiropractic biophysics. And that technique, CBP, specifically focuses on correcting improper curvatures within the spine. So that is what this little pillow, you could call it, the Denneroll, is for. So when people have a reverse curve in their spine, adjustments do help with that, but you need something a little more to help get the ligaments really involved with changing that curvature back to where it should be. So when I say reverse curve, here is a spine. So this is the spine against my neck. You want the curve to be going this direction. Oftentimes, this could be due to injuries that may have happened or just chronic people who are sitting at a desk all the time, have their arms forward and their head forward. Kids who are on their phones all the time, they especially have this. What will happen is that curve will start to straighten or it will actually go into a reverse. So when you have that reverse curve, you need to be doing things to stimulate the muscles, tendons, ligaments to correct that curve. And that's where the Denneroll comes into play. So with this, and we've already had several patients use it, they notice a huge difference, a relief in their neck tension and neck pain because they're finally getting their curve back to where it should be and their muscles are at the proper length. So how this works is you find the area of the reverse curve. I do recommend taking an x-ray beforehand. It's very inexpensive to just get an x-ray on your neck, like 35, 40 bucks. But I recommend getting an x-ray, finding out where you have a reverse curve in your neck. And that's where we place the top of this when you lay down on it on the floor. So I'm not going to go into huge detail about how to properly use this because if you get one, I want you to speak to either myself or one of the other doctors in the office, and we will demonstrate how it's used and where exactly you need to have it, and we'll watch you do it to make sure you're doing it correctly. And then, of course, we have people start out at a very short amount of time and work themselves up. I personally am a fan of the idea of every family having one of these in their house, especially if you've got teenage kids, because kids are losing their spine by the time that they're 13, 14 years old. I was one of them due to sports injuries. So playing soccer, starting really young, I lost the curve in my neck. And so even if your kid doesn't have neck pain, if they're an athlete and they're getting banged up a little bit, if they're on their phone constantly, if you notice that the shoulders rolled forward and the head forward, there's a very good chance they're already straightening out the spine in their neck or they're reversing it. So having this at home so that they can do it a couple times a week for not very long, you're basically combating what they're doing to their neck so that hopefully you can keep it in the position that it needs to be. So that is the Denneroll. If you want to learn more about it, find out if you need it, please ask us at the office. I'm a big fan of this. And like I said, everyone should have one in their home. I have one. Dr. Ashley has one. The women at the office use it also. There are people, though, that shouldn't be using it. So that's why you need to talk to us about it first. All right. So I hope you all have a fantastic weekend, and I will talk to you next time.